Without any further delay, let's begin today's event, From Analysis to Action, How Personalization Can Lower Employer Costs and Reinforce Your Role as a Trusted Advisor, hosted by Employee Benefit Advisor and sponsored by benefitexpress. With that, I'd like to introduce your moderator for today, and that is Lynn Gresham, Contributing Editor, Employee Benefit News, and Employee Benefit Advisor. Lynn, you have the floor.
Thanks very much, Phil. Good day, everyone. We're pleased to have you with us for this web seminar. Personalization is now part of everyone's online lives, and it's become the new normal for employee benefits. Of course, you can't have personalization without first having good data, which is what our expert speaker, Scott Evans of benefitexpress, is going to talk with us about today. Scott will explain how decision support tools can provide data to help employees make good health benefit decisions, help employers reduce costs, and help you build stronger relationships with your clients. But first, I'd like to tell you a little bit about him. Scott has over 20 years of industry-leading experience in client relations, leadership, strategic planning, and company growth. As Chief Product Officer at benefitexpress, he's primarily responsible for the growth and market competitiveness of all of benefitexpress's products. He's laser-focused on customer needs, and he represents the voice of the market as a direct advocate for client relationships. Prior to benefitexpress, Scott was COO of Benefits Connect and Vice President of Operations for Universe Workplace Solutions. Before I turn the program over to Scott, I'd like to ask all of you to tell us about your experience with decision support tools. This is the online poll that you heard about from Phil, and the question is, how are you using decision support tools today? Is it, I have a decision support tool that I use with the majority of my clients? I am evaluating partners for decision support tools. I want to learn more about decision support tools, or I don't offer decision support tools to my clients. I'm going to give you about 5 seconds to complete it, and then we're going to take a look at the results. Okay. It's fairly evenly divided. Most of you don't offer them or want to learn more about decision support tools, so you have come to the right place. With that, I'm going to turn the virtual mic over to Scott to get us rolling.
All right, thanks, Lynn, and thank you, everybody, for joining us today. And certainly, I appreciate you all participating in these polls. It certainly helps with the speaking points as well to kind of understand who we're talking to out there. So we certainly wanted to thank each of you for participating. We'll have one at the end as well. But certainly appreciate you taking the time out of your busy schedules to learn a little bit more. Again, this is intended to give you an overview and some steps, and certainly is not intended to be the end-all of end-all of, this market is changing, every day. It seems like, certainly in my role, I see it pretty consistently that, things are changing and technology continues to push forward and the employee experience continues to get better. So with kind of as we go into each of the slides, I'll kind of give you a summary of what we expect and what you should expect. But one of the things, and Lynn mentioned this as well, is, in the market today, we're really looking for personalization. So you think of your buying and shopping experiences, and we've put a couple of pieces there from Amazon to Netflix to Spotify. When you think about how you buy or purchase or watch movies or listen to songs, it's interesting how you see that. And then when we look at benefits, a lot of that same type of technology hasn't necessarily been as prevalent in the industry as well. And certainly, decision support is one of many aspects of this, but certainly giving the employee something that makes sense for them individually. It's no longer the standard in the industry to say, well, whatever's the cheapest plan must be the best option for you. And that's really not the case, as we all know as seasoned professionals in the industry, that employees have struggled with how do I handle the move to a high deductible plan, and what is an HSA, and what does that mean for me and my family? what I might enroll in and do for my family would be very different than Lynn and Phil and others as well, and each of you. So really making the technology to be able to personalize that, and we'll go through some things today, and certainly, our basis for all of that is how can we use data to help us be more laser focused on our client advocacy? What are we going to present to our clients? Making sure that we feel confident in those decisions of what plan design, those types of things that we're providing to our clients, and certainly helping our clients with employee retention. As we all see in the news, pretty much every day recently has been about how do we retain employees, how do we keep employees engaged in a very competitive employment market right now. So all of these pieces, you can't look at them kind of singularly as through the process. It needs to be looked at as a holistic piece, and this is just one of many aspects that we could look at from a personalization standpoint as well. So one of the things I always like to throw in some quotes here as well, but without data, you're just another person with an opinion, and how true that is that, as we meet and talk to our clients, data is an important factor that we can utilize to also help explain to them why we're offering them a particular plan or a plan design or a group of benefits. We have the ability to use the data to be able to do that. And that's really, the goal for today is to really talk about how do you get that data, what do we do with that data, and what does this really mean for me? So as I said earlier, we're going to hit a lot of the high points and certainly hope that this is helpful to you in your day-to-day of working with your clients. So one of the things is why use data analytics? Before we get into kind of how do I do all of this? How do I put all this together and make it make sense for my clients and for me as a trusted advisor, is why do we want to use data analytics? And we've put some highlights here, really at a high level to uncover insight and to improve plan design. As I mentioned earlier, not every plan design is the same across every company. Some things work for some companies, some things don't. We'll talk about a little bit later how I've seen in the past where plan design has helped curb behaviors or help people be better consumers. The other piece of why data analytics is extending your reach. Again, clients that you may not necessarily have had the ability to reach, and certainly when other clients share with others on how their trusted advisor is handling their plan design and how they offer benefits to their employees, and it's a positive thing, it certainly should help in the growth of your business as well. The other thing is saving costs for you and your clients. So you might say, well, how is that going to possibly save a cost? But think of it as a trusted advisor. If you are using data and a particular plan design or a particular benefit plan resonates with a certain industry, and you have a client that's in that industry, you don't necessarily need to go out to the market and do all kinds of, if we know that, for instance, critical illness is a need for this client, you're able to focus in and be able to save some of your costs of going out and marketing to different carriers throughout the process as well. So, and your clients as well. If employees are happy and they're appreciating and understanding their benefits and they're utilizing their benefits that's working with them, it's going to save costs from them, from recruiting new employees to potentially medical costs of having educated consumers using the plan in the most efficient manner helps with those claims, which then helps with certainly the potential increases in the future. So the other piece that it allows you to do is defining effective benefit packages, and I mentioned that a couple of times. It allows you to say, okay, this has been effective in this particular industry with this particular demographic. Here's what has worked for other clients in similar situations. So again, allowing clients some sort of comfort level of that, the data is pointing to here, not to say you couldn't go in a different direction, but at least directionally you're able to provide them with some information in the background to be able to do that. And then certainly last but not least, is making the enrollment easier for the employees. And, it's allowing them to understand and not hit them with, a ton of stuff on the screen. And, when you see it, people get a little nervous and what do I do with this? So, harvesting this data and getting information and certainly decision support as we get into here in a minute, the enrollment process should be made easier for the employee. It should be a better experience, like I said, and more personalized to them as well. And certainly the recommendation engines that you may be evaluating or using with your current vendors, we'll talk a little bit about that. So before we jump into the ways you can use the data, is where do you find the data? So let's kind of start at the entry level and kind of figure out where we need to go from there. And I would say as a basis point, benefits administration technology is really a way for you to start collecting that data. Certainly human capital management software is also a way for you to collect that data if your client has that information. But really you're looking at, in order to really be effective in how you're providing that personalized approach to the employee, is through the benefit administration technology that you're offering to the employees. And I know a lot of you that are on the call today, certainly have that for you and your client, or maybe you are a client already utilizing that technology. But surprisingly enough in the market, there's still quite a bit of the market that is not necessarily utilizing benefits administration technology, certainly human capital management, as globally, maybe for payroll. So, I like to mention that because sometimes we've gotten, in prior meetings, people have said, well, where do I even start with all of this? All of this sounds good, but what does that mean for me? So a couple of the things that, we wanted to highlight here, and again, you may have your particular technology systems that you use. This is not certainly specific to us, but, things of data that you can consume and data that you can pull from the system as a trusted advisor or certainly a client, ranges all the way from employee census to plan enrollment reports to plan summary reports. We have consolidated billing in there as well. Now, all of these reports, depending on the client, may not necessarily utilize or give you the data that you're looking for. You may have where you're able to do a custom report in your particular technology, which is great to be able to utilize that and kind of really hone in. But really what you're looking for is, who are the employees, kind of the demographics of them, and certainly what is their behavior? What is their buying behavior of plan enrollment? So, are they enrolling in medical, dental, vision, and life, but the other plans are kind of dropped off, or they're not as near as high participation, or maybe there's very little participation in them? What could you do as a trusted advisor to help your client maybe increase those types of things like life plans and critical illness plans and accident plans, and the list could go on and on. As we know in the industry, we have a lot of great products that are out there that some fit for some clients and others don't. But utilizing and using the data out of your Ben Admin system or your human capital management system, certainly is beneficial to you. And like I said, you may have to pull multiple reports depending on your system, but the ability to look at the behavior and the census data along with that plan enrollment really is important in the process as well. So one of the things of digging deeper, so reports are great, right, and data is great, but where else can we get and extract data? So one of the areas for that is certainly as decision support, looking at benefit plans and how they're scoring, thoughtful choices, set preferences. So things like this is one of the things that, I'll stick here for a few minutes, is, decision support really isn't, I think in the early days a lot of it was, a lot of laundry list questions, right? They were, asked kind of a personal questionnaire, so to speak, of information. But when we think about a lot of the information that we were asking, we already had as part of our system or part of a human capital management system or a Ben Admin system. And it was really stepping back and asking the question, why re-ask something that we already have that then is creating the appearance to an employee that, oh, I need to provide even more information, and the frustration point. And getting back to one of our points of making the enrollment easier for the employee is really an important, crucial part for decision support. So, when you look at that is how can you make it simple? You can look at things like national databases. Look at a person like that particular person. So when you pull demographics of age and gender and family unit, who's included in that family unit, what are their risk tolerances? That's another one that, I think a lot of people miss from a decision support perspective is just because the plan might be the highest scored plan, if that employee is risk adverse, or maybe they just don't have the money and the savings to be able to handle, a out-of-pocket or a deductible expense, that may not be the best plan for them. So this goes back to that tailoring this personalized approach is decision support is a key piece of that. And it allows the employee to really answer questions from demographic to their family unit to medical conditions. And again, simplicity there is key and confidentiality there is key. And then, what is their risk tolerance? What can they theoretically afford based on their family unit and their income? One of the things with decision support that you'll always have to respond to from a client perspective is how do you protect the data there, right? If we're collecting health, whether it be a health question or whether it be what prescriptions are you currently taking that lead to a particular medical condition, that's very personal information. And, I would say a word of advice there is to make sure whoever the provider is you're looking to partner with or potentially you are already partnered with is make sure and ensure that that data is completely not traceable back to the employee. Certainly a lot of technology there that you can, kind of dump that information once the employee's passed those screens and the recommendation has been presented to them, or not storing that data because you don't want to have those types of things stored, particularly in the areas of medical information. You don't want to have that stored. So really from your perspective, I would look at things like that as kind of just a best practice, right, to be able to make sure that, information is not even potentially could ever be breached, and kind of making sure your technology provider dumps that particular data as well. So that kind of gives us kind of the overview, and again, that was a very brief piece of it, knowing that we have you for a limited amount of time on a webinar, and I want to be respectful of your time as well. But that's kind of some of the areas of pulling data. So think of it as multiple technologies that you could utilize to do that. Again, it's technology agnostic. So you're able to utilize what clients have. So the other piece, and I think probably the more important piece for you as a trusted advisor or client, is how do I use this data? Like what does this do for me, right? What is the benefit to me and my agency or to the broader scope of my client? So what we've attached here is really 6 items that, and again, this is simplified for you, but 6 items that we think are key areas that from a data analytics perspective, what does this do for you as the trusted advisor? And I'll go into each of these in more detail. We'll just kind of hit on the highlights here, and then each screen after we'll kind of talk about the specifics. But first and foremost is increasing your client interactions, which is always a good thing from a sales perspective and relationship perspective as clients like to do business with people that they have a great relationship with. 2 is repurpose your consultative model. So really changing maybe the way that you're looking at presenting plans and options to your clients. Predicting results. This is one that, if we all had our crystal ball, obviously it would make the world of consulting easier. However, we have data. It may not be the 100% crystal ball, but we certainly have data to be able to help us predicting. So example of this would be if a client's going to a high deductible health plan and maybe they never have done that before. There are some that are out there that haven't taken that plunge yet. But if they haven't, you can really, literally look at other data to other similar clients to hopefully help do some predictive results. The other piece is refining offerings. So we've talked about this, and we'll talk about that in more detail as well to really be able to know what benefit package is going to resonate with that particular client and employees. Helping employees make smart decisions, I think we can't stress that enough of the importance and why. And then prioritizing time and resources. So that goes into both the employee, employer, as well as the trusted advisor as well. So those are really kind of 6 key items that we think that these areas would strengthen your role as a trusted advisor. And like I said, we'll go into the detail of each as well in that process. So first is we talked about increasing the client interaction. This is one of the things that, is always, and certainly there's quite a few people on the line that are long-seasoned veterans of this industry, but it is a very relationship-based industry. And, the way that, you're able to increase interactions with clients is sharing new insights from the data. No longer looking at your job, so to speak, as an annual enrollment, and then you have the closing meeting of annual enrollment, and then you'll have a renewal meeting sometime in the summer or whenever that particular client has those needs. Looking at the data throughout the year really helps you as a trusted advisor to be able to go back to the client and really look at things, in a different lens. Outside of the craze of Q4, as I call it, we all know everybody's running 20 different directions during that time, but it really allows you to focus on, and it doesn't have to necessarily be just specific to enrollment information and how people are purchasing the plan, but I would say incorporate how people are using the plan, right? Incorporate do you have employees that are high users of the emergency room or urgent care? Do we need to provide education around those types of things? Do we need to provide education about mail-order drug programs that are a part of the benefit that maybe people aren't participating in if it's a non-mandatory mail-in type plan? So those are the types of things that, I would encourage you, let the data help you have those conversations, and they don't have to just be towards purchasing and how the employee is purchasing those benefits, but how are they using those benefits? What can we offer as additional education throughout the year? Dovetail into that wellness, right? A lot of you have introduced and currently use wellness initiatives with your clients as well. Those are great. Also to continue to offer those types of models and those types of education. The other piece is repurposing your consultative model. So that's one of the things that we're looking at is how do we use the data to help you be kind of target and laser focused in what you're advising to your clients. So things like, if you see a multiple clients in different industries, there's typically industry by industry. There is some modeling there. There's the ability for you to look at data across those industries and kind of look at what makes the most sense for this particular manufacturing client versus a law office. They may have very different needs, but if you compare law office to law office and manufacturing company to manufacturing company and say to a client or a prospect, look, we've had a success with this manufacturing client, book of business, and here's what it's resulted at, and here's what we've seen as far as participation. Here's what we've seen as year-to-year type renewals and those types of things. Again, none of that is 100% exact science because every client is unique. It's certainly not a one-size-fits-all, but you're looking for ways to use that particular data to make it scalable and repeatable in your process. And we all know, we only have 24 hours in a day. That's all we're given. Each of us, although some of us would probably like to see a little bit more or maybe that more added or maybe some less in a day, right? I mean, we all have those particular days. But, really looking at data to help you with that laser focus as opposed to feeling like you have, a very broad brush that you have to paint with your clients as well. The other piece is predicting results. So this is one that, and I personally can say from a personal aspect, using it to predict results is a huge factor for you. So, through the years, I've had, various clients that, they may have, like I said earlier, taking the plunge, and there still are those that are out there in the high deductible plan arena. And, that's always something that as you're working through that with HR and certainly with the CFO of the company, they're typically looking at that and making certain financial expectations and budgeting items of migration from a PPO to the high deductible plan, just as a very basic example of that. But, one of the things, and it's very powerful, is being able to use the data, like I mentioned earlier, on other groups that are similar industries to say, this is the process that we went through. We used decision support. We used communications to reach out to the employees. We used the technology to be able to be the most efficient as possible for the enrollment process. And using all of that, here was our results. And we saw, and I'll just throw out 30% adoption rate of the high deductible plan in year one, or maybe it was 80%, whatever the case may be. You going to a client that maybe is doing this for the first time, usually their first question or shortly thereafter is, what do we expect from this? What do we think we're going to get from this? And certainly the CFO is, what financial considerations do we need to make for this, or budgeting changes do we need to make? So being able to help predict those results, again, every company is unique, so I certainly don't want to espouse to a one-size-fits-all, but this should help you as predictive measures to be able to push through with a client what they can expect based on others in similar industries. And I would say, keep it to similar industries is important because you're going to get, like I said earlier, you're going to very different in a law office to manufacturing to retail to restaurants. It's going to be healthcare. It's going to be very different for them. So I would really look to keep in the similar industry to be able to do that, which should help you, again, in looking at and advising clients on others that may be taking that similar change. And that could be, I use medical as the example, that could be dental. It could be, critical illness. It could be accident. It could be life insurance that you could look at from that perspective. So it really is not specific to medical by any means. The other piece is to refine the offering. So this was number 4 on our list. And, this really goes back to how do we tailor the plans that meet this particular employee's needs. So, one of the things is looking at this is how do we take the data and say, okay, well, this is the behavior of the plan, so this is how we need to modify the plan design. So things, I would say here key is probably your data from the carriers, your claims data, the de-identified claims data, so that you can see kind of the behaviors there. Maybe you need to look at potentially changing a plan design, or maybe you need to look at potentially offering a buy-up plan or a different way of doing the HSA and FSA contribution. So there's multiple ways that you can really look through and refine those offerings, obviously with the right data behind you as well. And the other piece is helping the employees make smart decisions, which we talked about earlier from a decision support perspective. The other piece is data analytics in general. So when we look at employees in our system, for instance, and again, this is certainly not exclusive to us. There's other providers out there that I'm sure do this as well. But, we are constantly looking at our system to make sure that as employees log into the system, we're looking at how long they're spending on a particular page. We're looking at, are they getting stuck halfway through the enrollment? And it may not be system related, just the communication and the messaging. So those are the kind of things that we look at. It's really not related to the system or the technology. It's more of how is the employee behaving. And, one of the things we've had, and we certainly have had clients over the years for this, is, we may see a lot of confusion around flexible spending accounts. That's usually an area of confusion. Or we may see when they go to the flex account enrollment piece in the system, they're spending a lot of time on that. So then it becomes, how can we target the messaging differently? Should we be explaining this differently? Before we even get to the enrollment screen, should we be targeting them to educate themselves via a video or something of, information that they can see and tangibly see that? So those are things that I would look at throughout the enrollment process is, how long are people spending on an enrollment? And if you see in a client group that they're spending 23 minutes across the board, and you have a client in a similar industry, and they're spending with a similar benefit package, and they're spending 45 minutes, there's probably some tweaks that we need to do to the education and the communication of those plans, whether it's pre-enrollment communication or technology communication during enrollment, or just follow up with them so that they understand how the benefit works and as well. So those are the types of things, is making the employee and helping them make smart decisions. It's not a one-piece thing, because we all have, and actually met with a company a few days ago that has a whole process where they go through and they look at people's different personality types and how those different personality types translate into different ways that they need to message them throughout the enrollment process. I think all of those are very encouraging items in this industry, because I think it certainly allows us to customize that messaging for employees. So I think this is just the basis. I mean, when you think about decision support and communications, but I think you'll see as the years come, I think there's going to be a more concerted effort around the buying habits and what employees, how they want to see things done in the system. So when you look at, Amazon, for instance, and you go in and you purchase things from Amazon, they always take the opportunity to tell you that others that purchase this product also purchase these 3 products, and click here and those will be added to your cart. Those are the types of things that, while our industry is certainly not the same as Amazon, it's, health decisions and benefit decisions are a very personal thing and are a very crucial thing to both the future and our family's future and the family potentially happiness and prosperity for future generations as well. But however, the information here is helping the employees make those smart decisions. And I think we can learn a lot from looking at the retail sectors that have been doing this for very many years of product placement and where on the shelf in the store and the place in the store to be able to do that. And I think we could look to that for benefits to be able to do that. And things like, example there is voluntary benefits. If you have a critical illness plan, why is the critical illness plan at the end? It should be with the medical plan. As if you were looking at this from a retail product placement perspective, that critical illness can complement the health plan. So things like that to look at and to consider and certainly ask of your providers is a key component of that. And then last but not least, and certainly important to everybody, prioritizing time and resources. As we all know, as I said earlier, we only have so many hours in the day. In addition to that, we only have so many resources at our disposal. And I think really here, using the data to show which plan design works well and those that are maybe less effective helps you to be more laser focused in what you're offering to your clients and what information that you're providing to them over the course. And we know that, certainly have a high respect for trusted advisors, and it's some think that that's an easy job, but knowing and working alongside through the years of many trusted advisors in the industry, it is a crucial piece. And if you think about our customers, they spend a lot of money on benefits for employees, and really making sure that their spend is done in an efficient manner is certainly top of mind for most as well. So those are really the 6 items, and a couple of things, I wanted to kind of bring all of that back and kind of gave you the 6 highlights, at least from our perspective, is to really kind of come back to the decision support tools and how can that help lower employer costs. And, we've really, similar to the prior slide, we've kind of given you a summary slide here from, one, supplementing human resources departments, and two, making the use of the data faster, and then maximizing the long-term value as well. So how is an employee using the plans and the benefits? How are they helping themselves or their family by being able to do that? So a couple of the things as we go just a little bit deeper into those is, supplementing the HR department is a key function. And those of you that are on the phone, and I think there are a few of you that, are human resource professionals and do this every day. I mean, time is critical for you as well, and certainly in most organizations that we are aware of, and maybe there's a few on the phone that aren't, is you don't have the time to sit and meet individually with every employee and review their plans. And, there's multiple ways, right, that you're able to accomplish that as a human resource professional. But certainly technology has helped in those instances. So think of, your technology that you're currently using. Think of that more than just an enrollment engine. Use it as an engine to be able to educate. Use it as an engine to be able to drive employees to that particular site or system, whatever you may be using, to think about things that are not just benefits. And I say things like, take credit for things that, are employer-paid benefits that the employee may not even realize they have, or they may realize they have, but they don't understand the real value to those. So those are some of the things of thinking of Ben Admin as, not just a transactional capture information. That's certainly one of the key hallmarks of it. However, it can be utilized and should be utilized as more of a 24/7, 365 place to go to learn more about benefits, how to use the benefits, and certainly for any benefit transactions that happen throughout the year. So, we feel that, our position as decision support is just one of many tools that should help the HR department spend less efforts. And, one of the things I'd say, because I've had the fortunate opportunity to be kind of in the employer market as well as the provider market, and, nothing's worse than sitting across from an employee that maybe can't afford the health insurance that they've signed up for, or maybe they signed up for the cheapest plan and that really wasn't the right plan for them based on the deductibles and out-of-pockets for that employee. So I've always encouraged even our team here is don't forget about the end customer. What we do is very transactional, and obviously the sites and the technology, but at the end of the day, there's real people behind it, and we want to offer tools that allow the HR department to help in those situations, and we hope prevent some of those situations. And like I said, I've been unfortunately part of conversations where we've had to have bad news and with an employee, and it's a very different perspective than those that have only seen one facet of the industry as well. The other piece is making use of the right data faster. So really streamlining, how do we look at the data, and certainly within any technology that you're evaluating, there should be, or using, there should be things like a dashboard or reports that you can see. You can see trends throughout maybe it's open enrollment. What are the trends? Where are people at? How many people have completed? How many people have not completed? What have been their behavior in the decision support piece? So things like, it's great to have decision support, but if nobody ends up using it, that's a disconnect. So think about if they go through the decision support process, get to the end, and there's their 3 plans, whether they're scored or whether this is highly recommended. There's various versions of what that looks like post, and at the results page for decision support. But think about is what the data that you should pull is, how many people went through the process and chose that plan that was recommended. So if you see a lot of employees going through it and they get to the end and plan A is being recommended, but they consistently are choosing plan C, that is an opportunity for education opportunity. That goes back to how do we change the messaging? How do we make sure that we're highlighting the differences of those three plans? And maybe C is the right plan for them. I mean, that's the reality of it too. But, if you're looking at decision support and the results of it, again, depending on the decision support tool you're using, if it's using data to give you the results, or the recommendation or the score, whatever the case may be, that should help the employee understand where it's coming from. But I think you should also see higher utilization of the recommended plan as well. So it's something to be looking at. Again, tools are great and things are great to be offering to the employees, but how they're using it is, I think, even more important in the process as well. And then last but not least is really maximizing that long-term value. And this is the thing of, the annual costs, and we've all heard the speeches and the stories and, the news articles on, healthcare in the United States. You probably can't turn on the channel and not hear it at some point during the day on multiple news channels. But the fact of the matter is using this decision support, using education, looking at employees' demographics, looking at their buying habits, making their buying habits easier, making their ability to be able to access education to make those decisions. All of those are good things to help with those long-term costs. Certainly, I'll throw in wellness to that as well. So some of you have, long adopted to a very great wellness plan for your clients. And it's worked for some, and others it probably hasn't worked as well. And, look at those things as you do every day, and maybe it's just the demographic, maybe it's the employer's vested interest in that particular wellness initiative as well. So things like that, and certainly I don't mean to say that decision support is the end-all and you're going to get cheaper premiums from your healthcare provider. But the idea here is if we have educated people that have access to education, we're offering them education, we're looking at the right design that meets their needs and their family unit's needs. All of those are helpful things to help control costs and certainly produce a happier both employee and employer, right, as a twofold. So, one of the things, as we kind of close this out, and we'll do one more poll question and some other questions. So, I would just challenge you with anything when it comes to benefits, and certainly don't look at this as just the data, but one size fits all is no longer acceptable, I would say, in our industry. We're really looking at how do we tailor the messaging for the various different age groups, that we have throughout the country. We can't have one message and expect it to hit everyone. And we need to make sure that we have the ability, and I would say these tools of decision support and utilizing, analyzing the data are just one of many steps that you should be looking to create the client and the employee's own adventure in the process. And with that, I'll turn it back over to Lynn to do our poll question, and then we'll go into question and answers.
Great. Thanks, Scott. There were so many great ideas there for taking client conversations to new levels, so thanks very much for that. We do have the poll, as Scott mentioned. Our question is, where are you now in your journey with benefits technology? The options are, I'm satisfied with my benefits technology offerings. I'm evaluating partners for benefits technology solutions. I want to learn more about benefits technology, or I have an in-house solution for benefits administration. We'll give it a couple seconds for the results to tally and take a look. Okay. 41% of you are satisfied with your benefits offerings. 27% say you're evaluating partners. 32% want to learn more about benefits technology, and no one has an in-house solution. Scott, do you have any thoughts about those results?
Yeah, I always like asking this question, and some of you are probably like, why are we asking this question about technology? And one of the biggest reasons is I asked this at a session earlier this year that I was doing, and it was very interesting results because I saw more of evaluating than I did of any other category in this particular question. And, it's always interesting to me to see where all of us are at in that process. And certainly, those that, are evaluating and wanting to learn more, there's a lot of information, out there, maybe too much information you may feel on some days as well. But certainly looking and evaluating partners and, certainly those that are satisfied, with their benefit technology offering, that's great. And, there's a lot of great providers out there, and it's great to hear that, you're satisfied with that. But I would say those that are evaluating and looking to learn more is, and I mentioned this on a prior webinar that I was on as well, is really look past, my advice to you is look past the demo. Look into the behind the scenes and look at things like you need to have technology that is first and foremost, but you need to have the service people behind it, and you need to have the subject matter experts behind it under that company as well. So those are the things to look at. And again, that's just words of advice that I've seen through the years as well. So Lynn, I'll turn it back over to you for questions.
Okay, great. Thanks very much. We do have a couple questions already in queue, and Scott welcomes your questions. The first one is, how is analytics evolving in ways that brokers should be thinking about? For example, what do they need to be thinking about when considering how to include wearable devices, mobile and online trackers, interactive software programs, or even social media and other similar tools into their health benefits mix?
Yeah, it's a great question. One of the things, and there was a laundry list there of different ways from social media to wearable devices, but, I think one of the things that, brokers and trusted advisors should be looking to is, how do we take this simplicity and make it simpler? I shouldn't say very complex thing and make it simpler. And I think all of those items of technology are important. Wellness certainly has a lot of wearable devices, those types of things, that you certainly should be looking at. It's also going to be take it in steps. So don't take it as you have to go from 0 to 100, over the course of this year. Look at it in steps and put together a plan. And I think, brokers should be looking at the data analytics piece of it to help you with the predictive piece of it, making sure technology and communications are streamlined, and then looking at those things of social media. I think social media is a great outlet. Certainly those that are younger, it's all about Snapchat. And those are things that don't rule out any of those arenas to be able to help and educate employees throughout the process. So I think those are all tools that you should be looking at and considering. And in some clients, it's not going to work. But, if you are talking to a technology company in San Jose, they're going to be looking at things like, how do you incorporate social media into your enrollment process? And I think those are all encouraging items in our industry, and I think certainly getting to a more streamlined way of doing it is certainly a good thing. And certainly I can't say enough, the data analytics behind it says it all. And I don't think we've done a great job across the industry of using data to help us make future decisions.
Okay, thank you. The next question is, does the analytics methodology incorporate claims data for valuable utilization insights?
Yeah, I would say you have to incorporate. So there's different schools of thoughts, on claims data, right? So, you'll have claims data from an employee perspective. It may not necessarily be an indicator of future claims, right? They may have had maybe a catastrophic event, or a birth of a child, or a hip replacement, something like that this year may not necessarily be what they're going to have next year. So one of the ways to look at that, and certainly a different approach, is to look at, as I mentioned earlier, look at that family unit or person and find that like person in national databases that has similar medical conditions, similar salary or household income, similar zip code. Those are the types of things that I think do need to be incorporated into a decision support tool. Otherwise, you have an employee signing up based off of, well, I went to the doctor 5 times last year and I'll go 5 times this year. While it may accomplish something, and I think the early days of Ben Admin with decision support, that was kind of where everybody was at, or most people were at. I think we're pushed past that. We've got to utilize both national databases and maybe individual databases for that particular client to predict some of those future costs. Because the reality of it is an employee doesn't understand, coming from an HMO to a high deductible plan, they don't really understand what that means necessarily. We've been through the years conditioned, certainly back in the days of HMOs, it was very, you go to the doctor, it's $20 and you left, not realizing that visit might have been $300. So, now with consumer-driven plans, we really have to look at that. So, I think utilizing claims and looking at that information, certainly looking at bad behavior, as I call it, in your claims results with your health provider is certainly a beneficial thing both for you and your client.
Okay, the next question is, where does the data come from to provide the analytic results, and how is it loaded into the system?
That's a great question. A lot of the analytics, again, speaking, everybody's system may be a little bit different in the process, but I would say the majority of Ben Admin providers, they have a lot of that data already in the system. The one piece, and I would say the to be determined, and there's some out there that I think are headed in this direction, certainly, is, how do you incorporate the actual, utilization data from the carrier. But I think all of the other analytics of the system, certainly, our particular system, we have dashboards for our clients, we have reports, we have graphs that we can pull from our system as well. So, and again, that's not specific to us. There's others that do very similar to that in the market as well. But those are the areas where a lot of it you already have, and it's just raising the awareness of how to access it, whether it be reports or dashboards or, maybe a consolidated report that you receive from your provider.
Okay, who are your decision support partners or vendors in this area?
Gosh, vendors there's a bunch of different ones. I would say, those we could certainly take offline with specifics because, again, we're pretty agnostic here from a technology perspective on decision support because there's many partners. I know for us we have multiples in our system because we have different clients that want different experiences, both as well as we have, our system that has decision support embedded in it, much like others in the industry as well. So, I would say, look at, there's a lot, let me just tell you, I will say there's a lot in the industry that are out there. Like I said, I would use some of the guidelines that I've showed you before. Some can't work outside of the Ben Admin system. Some are linked to a Ben Admin system. You really need to look at what makes the most sense for you. We actually have a version that you can embed in the enrollment experience, and we have one that you can have sit outside of the enrollment experience. So there's a lot of different functions and ways to be able to do that as well.
Okay, well, that's going to have to be the last question because we are running out of time. I'd like to thank everyone in the audience for joining us today for our webcast. We hope you found it valuable. I'd especially like to thank Scott for taking the time to share his insights and benefitexpress for sponsoring this program. benefitexpress will send you an email with the presentation slides and a link to the recording within 48 hours. That concludes our program. We hope you have a great rest of your day.